We are talking to Maggie Brennan. She is the president and CEO of North Shore Community Health, which provides comprehensive health care from dental to behavioral to North Shore and Cape Ann residents, regardless of insurance status. Hi, Maggie.
Hi, how are you?
I'm good. Did I introduce you okay?
Yes, that's great. Thank you. Thank you.
Well, could you do a better introduction?
Yeah, so we provide comprehensive primary care to anyone who walks through our doors, regardless of insurance or if people have insurance, and the services are medical, so primary care, you see family doctor, nurse practitioner, physician's assistant, dental, and behavioral health. So we have therapists on staff. We also do substance use disorder treatment. So we do, anybody who is struggling with particularly opiate use disorder, we provide services on site to those folks and have very skilled medical providers who can work with patients, provide medicines that can help with addiction. And we serve roughly 3,000 folks in Gloucester right now, and then another 10,000 throughout the North Shore, primarily in Salem and Peabody and Beverly. So,
and your offices in Gloucester are right on Washington Street near Addison Gilbert, right?
Exactly. They're right across the parking lot from Addison Gilbert, right? So, and we're open for business. We're seeing patients Monday through Friday. We're doing, to keep everyone safe right now, we have some protocols in place where people have to call first, so you can't just walk up to the door. Although if you do walk up to the door, you press a button and you'll be seen by actually a nurse who will do a visit right there and screen you. And then if you need to see one of our doctors or nurse practitioners, they'll set up an appointment for you to come on inside. We're just trying to do our best to keep everyone safe, particularly right now.
And you had moved to a lot of telemedicine last spring.
We did.
As many practices did, medical practices, but you're not doing that so much right now?
No, we are actually, and especially right now, just because right now we're sort of in a surge. So infections in the community are going up and actually pretty quickly. So we are seeing people on site, but for services that just, if you need to be seen on site, we'll determine that, work with you on the phone, and then see you on site. But a lot of the issues can be addressed via telephone visits or video visits. So we're still doing a lot of telephonic care for our patients. It's just the same thing right now.
Well, and we just want to emphasize that this is regardless of insurance status.
Yep.
You don't need health insurance. You can walk in with any problems. Yeah.
And if you need help signing up for insurance to determine if you're eligible for Mass Health or some other product, we have staff on site or on the phone who can help you with that. So, and bottom line is just, come through our doors if you need care. Come through our doors, and we're there to help you and to take care of you, take good care of you through this, perilous time for all of us.
Great. Well, and I know that you were on the front lines of testing last spring, at least for, parts of your community that you felt really vulnerable. Are you still doing COVID testing?
We're doing COVID testing for our patients, and we're still doing some testing of folks who live in shelter down in Salem. I think what's happened between then and now is the state has invested a lot of dollars and resources in helping the cities to organize Stop the Spread campaign testing. And most of the cities are working with, ambulance companies or another party to do the actual testing. So because we're relatively small and kind of spread out, we just really felt like we couldn't do that well. So we sort of, did the best we could for the communities that were the most vulnerable and communities who we were worried the most about. So, but that's really, we're mostly doing our own patients at this point, and some staff members, actually.
Now, we are going into some really tough times, which is particularly why we wanted to emphasize to people that you are there as, providing these services. What do you want to say to people during this surge? I mean, you were just on the front lines of healthcare.
Sure. What I would say is, please continue to be as safe as you can, especially right now. the infection level in all of our communities is just going up exponentially. So maintain your safety in the bubbles, continue to practice physical distancing, wash your hands, wear a mask, try to limit your activities to doing just the things that you need to do outside of the house. Now is just, we are so close to having a viable vaccine. Really, this is not the time when you want to let down your guard and get sick. So we're so close. So now please just continue to maintain vigilance. The other thing that I would just say is now is also not the year to skip your flu shot. So really we're recommending the flu shot for everyone. You don't want to get infected with the flu and COVID. Don't want to get infected with either, but so now is just not the time. So please also get a flu shot.
Mm. And will you be involved in any of the distribution of the vaccine, which is free, as I understand it,
Yes.
right?
Yes, it is. So actually, we just got word today that we could see some of our staff members get the vaccine as early as like the 22nd of this month. And then after that, yes, absolutely. I mean, our patients are pretty vulnerable, and a lot of them are essential workers. So we also advocated heavily for, and the state and CDC listened. So our patients are also pretty high priority on the list of the general members of the general public who are going to get the vaccine pretty quickly. So yeah, we'll be definitely involved in that, and look forward to getting the vaccines out there, getting people vaccinated, and then the day when we can all be back together safely again.
Mm. Well, one more time, you are available to anyone who's hurting right now and economically, and they need health care, whether it's dental, behavioral, addiction, you're there. Pediatric, right?
And we're open. We see patients Monday through Friday, 9 a.m. to 8 p.m. and on weekends, 10 to 6. So please come and make a call, or if you have to, stop by, push a button, and we'll be with you. So we are here.
Great. Well, thank you for all you're doing. We really appreciate it.
Thank you.